Here we will discuss about anatomy of a urinary system. A review. Urinary system comprise kidney, ureter, urinary bladder and urethra. Let's discuss about kidney. Kidney are a pair of brownish red structures located on the posterior wall of the abdomen from the 12th thoracic vertebra to the 3rd lumbar vertebra. So the location is posterior wall of the abdomen and it is located from 12th thoracic vertebra to the 3rd lumbar vertebra. Please note this point, 12th thoracic vertebra to the 3rd lumbar vertebra. And adult kidney weighs 120 to 170 gram and it's 12 centimeter long. Let's see the parts of kidney. Kidney contains renal parenchyma and renal pelvis. Okay. We will discuss about renal parenchyma. So this all area is called as renal parenchyma. So the renal parenchyma is again divided into renal cortex and renal medulla. See, this outer area is known as renal cortex. This outer area is known as renal cortex and the inner area is known as medulla. So the outer area is cortex and the inner area is medulla. Okay. We'll see what the cortex is contained. Cortex contains glomeruli, proximal and distal tubules and collecting ducts. So when you check cortex, you can see here collecting tubules or collecting ducts, proximal and distal tubules and glomeruli. So this is cortex. Cortex is the outer part of the renal parenchyma. When it comes to renal medulla, here you can see lot of conical pyramids. You can see lot of conical pyramids you can see. Okay, conical pyramids you can see. This is a medulla. So this is about renal parenchyma. I will repeat, renal parenchyma is divided into cortex, that is the outer area, and medulla, that is the inner area. So if you check in the cortex area, you can see a lot of glomeruli, proximal, distal tubules and collecting ducts. We will discuss about all those things later. Then medulla contains a lot of pyramids. Okay. Next we will go for the renal pelvis, the second part, renal pelvis. Renal pelvis is the concave portion of the kidney through which renal artery enters and a renal vein exit. So this area is known as the renal pelvis. In renal pelvis you can see renal artery and renal vein. So overall in kidney you can see two part, renal parenchyma and renal pelvis. Renal parenchyma again divided into renal cortex and renal medulla, and this is renal pelvis or hilum. Through this area the renal artery enters and the renal vein exit. Next, blood flow in kidney. If you check the blood flow in kidney, the arterial supply is mainly from abdominal aorta, and from abdominal aorta it will go to renal artery. Actually it's a branch, renal artery. From renal artery it will go to efferent arterioles, then glomerulus. So how we can see here how the blood is going to the glomerulus. You can see this is the abdominal aorta. From abdominal aorta this is the abdominal aorta. From abdominal aorta you can see the renal artery is going into efferent arterioles and glomerulus. When it comes to venous supply, you can see from glomerulus efferent arteriole and then renal vein. Then renal vein is going to inferior vena cava. So this is the blood flow. So artery, abdominal aorta, renal artery, efferent arterioles, glomerulus. Then venous supply from glomerulus, efferent arteriole, renal vein and inferior vena cava. We will discuss about glomerulus, efferent arteriole and efferent and afferent arteriole later. Okay. Next come to the important part, nephron. Each kidney contains about 1 million nephrons. Actually, what is nephron? Nephrons are the functional units of the kidney. So nephrons are the functional units of the kidney. If you check nephron consists of a glomerulus. I told you that we will discuss about glomerulus, etc. Nephron consists of a glomerulus containing efferent and efferent arterioles. So what is a glomerulus? Glomerulus contain efferent arterioles, Bowman's capsule, proximal tubule, loop of Henle, then distal tubule and collecting ducts. Okay, so these collecting ducts open into renal pelvis. So here you can see this is the photo or picture of a nephron. Here you can see Bowman's capsule you can see, and this is efferent arteriole. So from here the blood is coming from the artery through that renal artery is coming here in the artery through efferent arteriole. Blood is going into this Bowman's capsule, and after that this blood will be absorbed in the Bowman's capsule, and the other things are the physiology that we will discuss later. So the blood supplies through efferent arteriole, blood is going inside, then from here it will go to the the glomerulus. This is the glomerulus. From the glomerulus, what will happen? The blood will go into efferent arteriole. From efferent arteriole it will go to renal vein. So from renal artery through efferent arteriole it is coming into the glomerulus. Then after glomerulus, through efferent arteriole it will go to the renal vein. Forget about all those things because we will discuss about this in the physiology part. So it is the nephrons are the functional unit of the kidney, and this is the parts of nephron. Next come the ureter. Ureter is a long fibromuscular tube that connects each kidney to the bladder. So ureter connect kidney to the bladder. Ureter are narrow muscular tubes, 24 to 30 centimeter long, and originate at the lower portion of the renal pelvis. So we discussed about renal pelvis. So from the renal pelvis, ureter is originating, and it is terminate in the trigone of the bladder wall. So you can see trigone in the it's a part in that bladder. There it is terminating, and the left ureter is slightly shorter. The left ureter is slightly shorter. Very important. The left ureter is slightly shorter than the right, and the lining of the ureter is made up of transitional cell epithelium called urothelium. This is also important point. So the ureter is made up of transitional cell epithelium called urothelium. So lining of ureter is called as urothelium, and the left ureter is slightly shorter than the right, and 24 to 30 centimeter long. I forgot to tell you about one more thing. If you see the kidney here, the right kidney is lower than the left. Okay, so when you check the kidney, you can see right kidney. See here the right kidney is lower than the left kidney. So right kidney is lower than the left kidney. Okay, next we will see the urinary bladder. Urinary bladder is a muscular hollow sac located just behind the pubic bone, and the capacity of the bladder is 300 to 600 ml of urine. Note the point. Then wall of the bladder comprises. When you check the wall of the bladder, you can see 4 layers. The outermost or the outer layer is called adventitia. It's made up of connective tissue, and then the next layer is detrusor, smooth muscle layer, detrusor. Sometimes detrusor is called as a bladder muscle. Not the point. Bladder muscle. Detrusor is otherwise called as a bladder muscle. Then the third layer is lamina propria. This is also smooth muscle layer. Then again the last layer is urothelium. Actually the urothelium prevents the reabsorption of urine stored in the bladder. Actually it's having a type of water permeable. Water cannot be go through impermeable layer. So water cannot be absorbed from the bladder. So once urine is there inside your bladder, it will not be absorbed to any part. So this urothelium is like a plastic paper. You can say plastic paper or plastic covering. Urothelium prevents the reabsorption of urine stored in the bladder. So in urinary bladder, 300 to 600 ml urine. Then 4 layer. Detrusor is the bladder muscle. Then urothelium is also there. Urothelium prevents the reabsorption of the urine stored in the bladder. So these are some of the important points regarding the anatomy of urinary system. And here in if you check the urethra, this is urethra, and urethra arises from the base of the bladder. In male it passes through the penis, and in the female it opens just anterior to the vagina. Okay, very important. Urethra, if you see the length of the urethra, in female it is 1 to 2 inches, and in male it is 8 to 10 inches, the length of the urethra. Okay. So these are some of the important points when we go for exam. There may be questions covering these important points. Thank you.